Hello, my friend. Thank you so much for joining me today. My name is Brita Pobaluzwi, and I am here to share health-based information, health-based news, and health-based research with you. I hope that you are having a lovely day where you are. Most importantly, I hope you're having a healthier day wherever you're watching me from. All right, so we are still following the COVID wave, the current COVID outbreak, and I am reading from CNN Health. This is a story that was published on Friday, August 16th, 2024, and I am reading this on Sunday, August 18th, 2024. Right now, the time is 1:42 here in Columbia, Missouri. So what do I see? Let me read the story. I think it's a feature article, which means I will be jumping to some of the key points that are coming up, right? The headline of the story is the US is experiencing its largest summer COVID wave in at least 2 years. This is a story that was written by Brenda Goodman for CNN, published Friday, August 16th, 2024. It may be time to dust off the face masks and air purifiers. The US is in the midst of a significant COVID-19 wave with viral activity levels in wastewater the highest they've been for a summer surge since July 2022, and according to the US Centers for Disease Control and Prevention's wastewater dashboard. The CDC's measure of national COVID viral activity in wastewater rose to 8.82 on August 10th, falling shy of a peak of 9.56 in July 2022. The CDC says the most recent data is incomplete and may change. Before it started to rise again in May, it was at 1.36. This is a quote. Currently, the COVID-19 wastewater viral activity level is very high nationally, with the highest levels in the western US region. This is by Dr. Jonathan Yoder, the Deputy Director of the CDC's Wastewater Surveillance Program, said in an email. And I quote again, this year's COVID-19 wave is coming earlier than last year, which occurred in late August and early September. Emergency room visits, hospitalizations, and deaths are also ticking up, although not to the same extent as infections, according to the CDC's COVID dashboard. As of the end of July, the CDC's dashboard shows that 4 are being hospitalized for COVID for every 100,000 people in a given area, up from a low in May of about 1 COVID hospitalization for every 100,000 people, the lowest level since the pandemic began. The CDC's wastewater data closely aligns with what they're seeing at the Nation Wastewater Scan Network, too. This is a very significant surge. The levels are very high. They're the highest we've seen during a summer wave. All right, so essentially, this is an alert to us as publics to keep aware of the surge in COVID cases and to protect and prevent ourselves from getting infected and affecting others around us.